This demonstration is a guide to injecting with the Skyrizi pen. Watch it and also read the entire Skyrizi instructions for use leaflet inserted with your medication package. Don't try to inject Skyrizi until your doctor has decided you can and you've been shown the right way to inject. Skyrizi, risankizumab riza uses. Skyrizi is a prescription medicine used to treat adults with moderate to severe plaque psoriasis who may benefit from taking injections or pills, systemic therapy, or treatment using ultraviolet or UV light, phototherapy. With active psoriatic arthritis, PSA. Safety considerations. Skyrizi may cause serious side effects, including serious allergic reactions. Stop using Skyrizi and get emergency medical help right away if you get any symptoms of a serious allergic reaction. Infections. Skyrizi may increase your risk of infections. Before starting treatment, your doctor should check you for infections and tuberculosis. Tell your doctor right away if you have an infection or symptoms of one. Do not use Skyrizi if you are allergic to risankizumab riza or any of the ingredients in Skyrizi. Also, tell your doctor if you plan to or recently received a vaccine.
Hi, I'm Michael, and I'm here to show you how to inject using a Skyrizi pen. I've been doing this for a while now, and I feel like I have a good handle on it. My doctor showed me how to inject when I first started, and I called Lauren, my nurse ambassador, and she helped me the first few times I did it at home by myself. Now I get my Skyrizi by mail, and I keep it in the fridge until I'm ready to inject. There it is. There we go. So, very important. I'll leave it out at room temperature and out of direct sunlight for 30 to 90 minutes before injecting. Now that I've washed and dried my hands, I'm good to go. So I take out everything I need. I got my Skyrizi pen. I've got the instructions for use for reference. I've also got an alcohol swab, cotton ball, and my sharps container. So I do my injections here because there's just plenty of light and a lot of good space. I like to think about the injection process like this. Pick, pull, place, push, and press. So first, I'll pick my injection site. I'm gonna go with my left thigh, but you can also inject into your stomach or your other thigh. If you choose your stomach, make sure that you inject at least 2 inches away from your belly button. Grab your alcohol swab and clean your skin in a circular motion like this. And let it dry. Now, I hold the pen with the dark gray cap pointing up. I pull the cap straight off and throw it away. Now, I check the liquid through the inspection window. It should look clear to slightly yellow and may contain tiny white or clear particles. It's normal to see one or more bubbles in the liquid. So, I hold my pen with my fingers on the gray grips. See? And I turn the pen so that the white needle sleeve points toward my injection site and I can see the green activator button. I also make sure that I can clearly see the inspection window while I'm injecting. I gently squeeze my skin at my injection site to make a raised area and hold it firmly. Then, I place the white needle sleeve straight against the raised area at a 90-degree angle and push the pen down against my skin. Throughout the process, I keep pinching the raised area and keep steady pressure against it. I can see the green activator button and inspection window. The pen only activates if the white needle sleeve is pressed firmly down against me before pressing the green activator button. A loud click means the start of the injection. There it goes. And hold it like that for 15 seconds. Now, I'll keep pushing the pen down against my skin until I hear a second click or the yellow indicator has filled the inspection window. Either one signals the injection is complete. And there it goes. I check to make sure that the yellow indicator is fully down to be sure the injection is complete. Only then do I slowly pull the pen straight out from my skin. You might notice one last click. And look at this. You see how the white needle sleeve covers the needle tip? And that's it. Now, I press a cotton ball where I injected. You could also use a gauze pad. And I drop my used pen in one of these Sharps disposal containers. There. Safe and sound, and also out of reach. Another injection complete. To recap, I prepare myself in my space, pick an injection site, pull the cap off the pen, place the pen on the injection site, push the pen firmly down against my skin, press the button to inject, and keep steady pressure on the injection site for the full 15 seconds. Then safely discard the used pen. That's the whole injection process. When I started injecting at home, it didn't take me long to get it down. Lauren, my nurse ambassador, she suggested I create a routine, inject at the same time and place. I also like to treat myself after each injection. Yeah, maybe I'll cycle or listen to a new album. This SkyRizzy Complete app helps me stay on track, and I don't know what I'd do without it. I used it to log my first starter dose, so I knew when to take my second starter dose 4 weeks later. And you can set reminders for future doses too, since after 2 starter doses, SkyRizzy is only 1 injection 4 times a year. And when I get those reminders, I know to contact my specialty pharmacy to get my next injection on time. I'm lucky that my family's always around if I need help. I've got SkyRizzy Complete too, like Lauren, who has answers to my questions, and a pretty awesome app. You've got this.
Uses and important safety information. SkyRizzy, risankizumab Riza uses. SkyRizzy is a prescription medicine used to treat adults with moderate to severe plaque psoriasis who may benefit from taking injections or pills, systemic therapy, or treatment using ultraviolet or UV light, phototherapy, with active psoriatic arthritis, PSA. Important safety information. What is the most important information I should know about SkyRizzy, risankizumab Riza? SkyRizzy is a prescription medicine that may cause serious side effects, including serious allergic reactions. Stop using SkyRizzy and get emergency medical help right away if you get any of the following symptoms of a serious allergic reaction: fainting, dizziness, feeling lightheaded, low blood pressure, swelling of your face, eyelids, lips, mouth, tongue, or throat, trouble breathing or throat tightness, chest tightness, skin rash, hives, itching. Infections. SkyRizzy may lower the ability of your immune system to fight infections and may increase your risk of infections. Your healthcare provider should check you for infections and tuberculosis, TB, before starting treatment with SkyRizzy, and may treat you for TB before you begin treatment with SkyRizzy if you have a history of TB or have active TB. Your healthcare provider should watch you closely for signs and symptoms of TB during and after treatment with SkyRizzy. Tell your healthcare provider right away if you have an infection or have symptoms of an infection, including fever, sweats, or chills, cough, shortness of breath, blood in your mucus, phlegm, muscle aches, warm, red, or painful skin, or sores on your body different from your psoriasis, weight loss, diarrhea or stomach pain, burning when you urinate, or urinating more often than normal. Do not use SkyRizzy if you are allergic to risankizumab Riza or any of the ingredients in SkyRizzy. See the medication guide or consumer brief summary for a complete list of ingredients. Before using SkyRizzy, tell your healthcare provider about all of your medical conditions, including if you have any of the conditions or symptoms listed in the section, "What is the most important information I should know about SkyRizzy?" Have an infection that does not go away or that keeps coming back. Have TB or have been in close contact with someone with TB. Have recently received or are scheduled to receive an immunization, vaccine. Medications that interact with the immune system may increase your risk of getting an infection after receiving live vaccines. You should avoid receiving live vaccines right before, during, or right after treatment with SkyRizzy. Tell your healthcare provider that you are taking SkyRizzy before receiving a vaccine. Are pregnant or plan to become pregnant. It is not known if SkyRizzy can harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if SkyRizzy passes into your breast milk. Become pregnant while taking SkyRizzy. You are encouraged to enroll in the pregnancy registry, which is used to collect information about the health of you and your baby. Talk to your healthcare provider or call 1-877-302-2161 to enroll in this registry. Tell your healthcare provider about all of the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of SkyRizzy? SkyRizzy may cause serious side effects. See what is the most important information I should know about SkyRizzy. The most common side effects of Skyrizi in people treated for plaque psoriasis and psoriatic arthritis include upper respiratory infections, headache, feeling tired, injection site reactions, and fungal skin infections. These are not all of the possible side effects of Skyrizi. Call your doctor for medical advice about side effects. Use Skyrizi exactly as your healthcare provider tells you to use it. Skyrizi is available in a 150 milligram, milliliter, pre-filled syringe and pen. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. If you are having difficulty paying for your medicine, AbbVie may be able to help. Visit abbvie.com/patient access support to learn more. Please see link for the full prescribing information, including the medication guide for Skyrizi.